Okay, so hello dears, and welcome back to the second video on our lecture on autoimmune diseases. No? And for this lecture, we're going now to start with the different types of anti-nuclear antibodies. Again, recall anti-nuclear antibodies are antibodies that are against autoantibodies that attack the nuclei of human cells, mammalian cells, alright? And these anti-nuclear antibodies are found in majority of patients with SLE. That's why it's used as a major marker, but it's not specific because it can be used or it can be found in other autoimmune diseases and connective tissue disorders. Alright? Okay, so we'll now start with the first type, which is your dsDNA antibody. So with the name itself, it's an antibody or antibodies against the double-stranded DNA. Now, these antibodies are considered to be the most specific for SLE, and their presence is considered diagnostic for SLE, especially when found in combination with low levels of your C3 or your complement protein C3. Okay? So, because it's really found or really specific for SLE, ang imong dsDNA antibodies. Alright? So, antibodies against the double-stranded. DS there meaning double-stranded. Okay? DDS. Charot? Yeah. Okay, alright. dsDNA antibodies. Next, you have anti-histone antibodies. By the name itself, it's an antibody against your histone, diba? Your histone is a combination of your nucleosome and chromatin, something, basta part of your chromatin. Ah, Lord. Sorry naman, I forgot that. Okay, alright. So its presence alone or combined with an ssDNA. So SS meaning screenshot. SS is wait, now I remember the funny word. Okay, sorry. ssDNA, single-stranded DNA. Alright? So its presence alone, if siya rin nakitaan usa ang anti-histone antibody, or together with ssDNA antibody, it supports the diagnosis of drug-induced lupus. Alright? So there have been a lot of drugs, procainamide, no, isoniazid, yes, and other drugs pa that could lead the patient or that can cause SLE. Alright? Okay. So in the presence of anti-histone antibodies and or with ssDNA antibody yields or leads to the diagnosis of drug-induced lupus. Alright? Okay. And high levels tend to be more associated with active and severe SLE. Alright? So if high levels of anti-histone antibodies, it means that the SLE can have a severe outcome or severe SLE na naa. Okay. Alright. Ayan. Now next, another type of antibody or the next type of antibodies are your nucleosome. Your nucleosome antibodies directed against the DNA histone complexes. So it's a combination of the DNA and histone. When you say nucleosome antibodies siya against the complex. Okay, it's not an antibody na separate for DNA or separate for histone. It's the complex itself. It's an antibody against the complex na DNA histone. Okay? Alright, ayan. And found in about 80% of SLE patients, and levels correlate with disease severity. Okay. Alright. Next, you have the antibody to the SM antigen. Diba, recall it SM antigen or wrong antigen. Your SM antigen is an extractable nuclear antigen, ENA, diba? And this SM antigen is also considered specific for lupus because it can only be found in SLE. Alright, so specific yun siya. So you have two specific na, you have dsDNA and you have antibody to SM antigen. That's for lupus. And why is it called SM? SM means Smith, ayan, because it was named after a patient named Smith in which the antibody is detected, alright? Or in where the antibody was first isolated. Gikan sa patient na ang ngalan si Smith, kaya anti-SM antigen. Also, SM antigen because again of the origin. It came from a patient named Smith. Okay. Alright, ayan. So, napag mga X na Smith. Charot. Yes, okay. Alright, ayan. So, those are the first few types. Next, another one is your anti-RNP. So they are directed against RNP, ribonucleoprotein. Again, it's one of your extractable nuclear antigens. And your RNP, it forms complexes with your SM antigen in the nucleus. Alright, so mga ano niya siya, mga branch sa SM. Or mga ano siya, mga tenant sa SM. Okay. Alright, ayan. Now, next you have antibodies to both SSA-RO and SSBLA. They can cross placenta. They can cross the placenta and can cause congenital lupus. So that's what you need to, or these antibodies are significant, especially in congenital lupus. Your antibody to SSA-RO, they are associated with the presence of nephritis, vasculitis, leukopenia, lymphadenopathy, and photosensitivity, meaning intolerance or non-tolerance to light or to the sun, photosensitivity. Okay, and your anti-SSBLA, they can be found in patients with cutaneous manifestations of SLE. All right, but the main importance talaga is that they can cross the placenta and can cause congenital lupus if the mother has these antibodies. Okay. All right. Next, you have the antibodies to the nucleolus components, which can be antibodies to fibrillary, which is common in scleroderma. Your scleroderma is an autoimmune a connective tissue disorder. Alright? RNA polymerase 1 and PM1 sa mga inasal. Okay? Alright, so these are nucleolus, components of the nucleolus, which is again included or seen in your nuclei, in the nuclear components of your cells. Alright. And next, you have the anti-centromere antibodies. Or anti-centromere antibodies, by the name itself, they bind to the proteins in the centromere. And usually, a centromere is seen in mga cell division, and mitosis, in the middle region of the chromosome. Alright. Where the sister chromatids are joined. So they attack you in the chromosome itself. And they are usually found in patients very, very specific then and very diagnostic in patients with CREST syndrome. CREST syndrome is a subset or a type of scleroderma. Alright? So CREST syndrome stands for calcinosis, the Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia. So sclerodactyly is parang ay mga extremities kay ni nawalan siya o movement or like ni sclerodactyly. Mura siya giniwang, di ba? Dactyly. Mura siya, ako ma-remember kay pterodactyl, di ba? Parang sa dinosaurs. Yes, alright. So, and telangiectasia, di ba, na yung mga, in your hemato, ang imuhang mga veins, capillaries, kay mas maklaro, something like that, di ba? Alright, ayan. So, CREST is named after the different manifestations or the different presentations, which is your calcinosis. Calcinosis, magahi mo mga bones because yung mga calcium deposits, wala ko na sa'yo. Alright. Raynaud's phenomenon, we have discussed that. Esophageal dysmotility, kay ang imong esophagus kay dili na kaya siyang move, dysmotility. So wala na siya yung movement kaayo. Alright, so you cannot swallow food. So may swallow food. Alright, okay, ayan. So CREST syndrome. Again, it's an antibodies, anti-centromere antibodies. Press the buzzer. Okay, we'll encounter that later na naman. Alright, okay, so those are anti-nuclear antibodies. Now we go now to how we detect these anti-nuclear antibodies. So as you can see, diba, there are a lot of immunoassays, no? But the most important or the thing that we're going to focus is the indirect immunofluorescence test, okay? Or IIF, okay? Dili IATF, char. Okay, IIF. Alright. So indirect immunofluorescence, because it is this test, which is also known as your fluorescent anti-nuclear antibody, FANA, okay? That is widely used. This is the test that is widely used, and it's highly sensitive, alright? And ito yung malabas ng boards. It can detect also a wide range of antibodies. It's inexpensive and easy to perform, okay? It's used as a screening test to identify patients who have ANAs as well as patients who are negative for ANAs to provide guidance on what to do next, no? On sa mga immune, on sa mga follow-up assays na kailangan i-perform if negative ka ANA sa inyong FANA, alright? This is really the test that is important in detection of your ANA, alright? And this is, ito yung lumalabas sa boards, okay? Alright, ayan. Now for the procedures, it's an indirect immunofluorescence assay, diba? Recall, indirect immunofluorescence assay, of course, it starts first with your antigens, alright? Or cells in a fixed slide, alright? And in this procedure, we use what we call your nucleated cells or HEP2 cells. So these are epithelial cells, no? Cancer cells pa rin, diba? Usually, a type of cell din na ginagamit for cell culture for viruses, no? And other mga intracellular bacteria, ganun. Okay, so we use that HEP2 cells, and then we let it adsorb, no, on a microscope slide. And this is usually commercially prepared. Alright, so again, indirect immunofluorescence, if I recall, the method, you first have a solid phase antigen, okay? And then what you do next is you let it react with the patient serum or patient antibody, diba? Because we're expected, in this case, that the patient serum contains autoantibodies, alright? Anti-nuclear antibodies. And because again, anti-nuclear antibodies against the nuclei, diba, of your cells, that's why we use nucleated cells, your HEP2 cells, alright? So after we react, we let it react, the patient's serum which contains the anti-nuclear antibodies, we let them react, okay? Alright? And then what happens next is we, of course, after reacting, we wash to remove the unbound antibodies, and then we then add the AHG with the fluorescent label. It could be FITC or TRITC or what other fluoroprobes. Ayan. And then, of course, we then incubate pa and wash pa yun to remove the unbound mga tags, unbound antibodies. And then we examine, of course, under 400x magnification using a fluorescence microscope. Alright. And then, here's the procedure. Again, these are the cells. Wala ko kasabot ano ito. Di ka siya sa Stevens. Wala ko kasabot ano yung master ko. I don't know what that means. But anyway, so these are all your cells. Adsorb on the slide. You let it react first with the antibody from the serum, your anti-nuclear antibodies. Wash, and then of course, you then add your fluorescent labeled AHG or your tags. Alright? So very easy lang na pag-perform. Diba? So I hope na-gets lang ninyo. Very easy lang to capture po the principle sa indirect immunofluorescence and sa direct immunofluorescence. For indirect immunofluorescence, you let it first react your patient serum and your antigen, known antigen, okay? And then you wash, na washing step, munang indirect siya, kay dili direct ang pag-react nila, okay? Dili agad-agad, okay? Like dili jud antigen and then the fluorescent label tag. That's direct man, diba? But for indirect, solid phase antigen, your known, and then your patient serum antibody, which you are detecting. And then napag washing, and then dito pa ka mo add sa imong fluorescent label na tag. Okay? Alright, so muna siya indirect immunofluorescence. Alright, now that's the procedure, diba? Very straightforward lang. Now for the results, for screening test, we use a 1:40 or 1:80 dilution of your patient serum. Alright? To avoid detecting low positive titers that may be seen in healthy persons. But the significant titer is considered a titer of greater than equal to 160 and considered na clinically significant. So if the patient, example, in your immunofluorescence, no, at a titer of greater than equal to 160, na siya po yung fluorescence na ma-detect, or ang intensity kay intense na gyapon, ganun, ato ang grading sa FITC, if nagyapon siya ma-detect na fluorescence or intense na gyapon, at greater than equal to 160 ang titer sa mga antibodies, then that's significant. It means that it could be that taas yun ang level sa mga anti-nuclear antibodies sa imong patient. And that would mean correlate to the presence of an autoimmune disease or SLE ba. Alright. Now aside from your titer, if positive siya on the ANA screen, we serially dilute, mag-serial dilution ta, to determine the antibody titer. Again, specified as the dilution, highest dilution to show nuclear fluorescence, as I mentioned in the previous discussion. Alright, okay. Now aside from titer, we also look for the pattern of fluorescence. Ayan, so this is now what we're focusing, kaya ito yung lumalabas sa boards, alright? The pattern of fluorescence, because it's in the pattern of fluorescence that can provide you on what is the autoantibody that is present, and eventually what type of autoimmune disease ba ang namin. Alright, or if it's really for SLE ba or whatever. Okay? Alright, ayan. Now, there are about 40 patterns of immunofluorescence in this test, but we'll focus on the more common, which is 5. You have the homogeneous, peripheral, you have speckled, nucleolar, and lastly, the centromere na pattern. Okay, alright. So, muli siyang lumalabas sa boards. Ito yung lumalabas sa boards actually. Ang mga patterns. Okay, alright. Now, we go now to the first pattern, which is your homogeneous or solid diffuse. So for homogeneous, pwede rin sa homogeneous. No, so all of the cells, no, all of the HEP2 cells are fluorescing. Okay, you can see fluorescence in all parts of the cell or in the whole cell. Okay, so uniform staining of the entire nucleus in interphase cells and of the condensed chromosomal region in metaphase cells. Now for the anti-nuclear antibodies detected, you can detect a lot. dsDNA, also known as your naive or nDNA, your single-stranded DNA, histones, and even deoxyribonuclear protein, DNP. So that's for homogeneous or solid or diffuse. And these can be seen or attributed to diseases, SLE, yes, drug-induced lupus, and low titers of homogeneous ANA can also be seen in rheumatoid arthritis, Sjogren's, I don't know how to pronounce, lapaw pa search, but I think it's Sjogren's syndrome, and mixed connective tissue disorders, so mga other connective tissue disorders, alright? Ayan, so Okay, and so that's for homogeneous. So as you can see, it's not really specific for SLE, okay? Other diseases can also be seen with this pattern. That's the first. Homogeneous, by the name itself, homogeneous uniform staining. Alright, okay, so we go now to the second type of pattern, immunofluorescence pattern, and that is your peripheral, or also known as your rim, outline, marginal, ring, membranous, shaggy, or thread. Ayan. So, by the name itself, peripheral, nasa rim. Ayan. Nasa outer lang. Nasa sides, okay? Oh my gosh, my brain talaga hated. Okay, anyway, peripheral, nasa outer lang. Outer parang, you have the, like example, this is the nucleus, nara siya dili, nasa rim, nasa sa peripheral, nasa sa sides. Okay, alright, so there's still diffuse staining in the nucleus, but there's greater intensity, meaning mas higher, mas fluorescent siya sa sides, okay? And the outer circle surrounding the nucleus and interface cells. Ayan. So the ANA detected is primarily caused by double-stranded DNA antibodies. And because double-stranded DNA antibodies, diba, most specific for SLE, it's therefore this pattern is also specific for SLE. Highly specific for SLE. That's according to Stevens. But for third joint, it can also be found now in active stages of your Sjogren's or Sjogren's syndrome. Diba? So, dito highly specific siya for SLE, your peripheral. Okay, so rim, and outer circle surrounding the nucleus. Okay, alright, and that's for peripheral na pattern. Okay, next we go now to the next. Next we go to the next pattern is your speckled. Ayan, so speckled by the name itself, na yung mga specks, meaning if this is the circle, the nucleus, na yung mga binagmay na mga dots or mga specks. Okay? Alright. And the specks can be fine, meaning smooth ang iyang appearance, or pwede po siyang coarse, meaning medyo rough yung appearance. So, asa man mo, smooth or rough? Ato siya sa rough. Charot! Okay, alright. Ayan. So, smooth siya, fine siya or coarse, depending on the autoantibody present. Okay. The antibodies detected, your antibodies to ENAs, anti-RNP, and anti-SM, according to third joint. Okay. And the diseases it may be seen from SLE, Sjogren's, systemic sclerosis, or scleroderma, and other systemic autoimmune rheumatic diseases. Okay. And the next pattern is nucleolar staining of your nucleoli. So para may mga dots pa rin. Okay. The size, shape, and number of your nucleoli per cell are variable, and staining can also be smooth, clumpy, or speckled, depending again on the antibody present. Okay. And the ANA is detected, you have RNA and RNP, antibodies to RNA and RNP. The diseases it may be seen, scleroderma, Sjogren's syndrome, or an undiagnosed illness that presents as a Raynaud's phenomenon. Okay, so it's more on the connective tissue naman disorders. Okay, alright. Ayan. So, we go now to the last pattern, yes, and that is your centromere. Diba? Recall, anti-centromere antibodies against a disease really selective or specific for CREST syndrome, diba? And for this pattern, it's also selective for CREST syndrome. Ayan. For centromere, again, na yung mga numerous discrete speckles pa rin, or mga specks seen in the nuclei of your interface and chromatin of dividing cells. Most cells have 46 speckles because again, that's the number of chromosomes that found in your human cell. 46, diba? Alright, okay. Again, by the name itself, the antibodies detected are antibodies to your centromere or centromeres of the chromosomes. Alright. And again, as such a disease, very selective for CREST syndrome. Ayan. Okay. Now we go into the different pictures on how we look at the different patterns. So the first one is of course your homogeneous. By the name itself, diba, homogeneous. Smooth yung appearance, uniform ang staining. Okay? Again, usually detected mga antibodies daghan, diba? You have ssDNA, histone, etc. And the diseases it may be seen from SLE, diba? Sjogren's, marami. Okay. Next, we go now to your peripheral. Ayan. As you can see, there is still diffuse staining at the center, at the nucleus, but at the outer circle, it's much more stained or greater intensities of fluorescence. Okay? Alright, so this is again highly specific for SLE, alright? Caused primarily by dsDNA antibodies. That's peripheral, right? The name itself nasa gilid na. Alright? Outer ring, outer circle. Okay. Alright. Next, we go now to your speckled. The name itself, as you can see, diba? Na yung mga specks, na yung mga circle, okay? And in this part, in this example, this is a coarse speckled pattern. As you can see, medyo really smooth ang iyang appearance. It's quite rough ang iyang appearance. So coarse, speckled. Alright. Okay. And next is your nucleolar. As you can see, the specks are not that big, no? Or not that parang prominent compared to your speckled. Because again, it's you only staining your nucleolus. So it's only a small part of your nuclei. Alright? Yeah, so muna siya ang imuhang patterns. And the last is of course centromere. So for centromere, the specs are much more marami. Because again, they're detecting your chromosomes. Alright? So for chromosomes, diba, they're around, daghan sila, 46. So the specs now are much more marami. Okay? As you can see, diba, this is the, you have mga specs. These are the chromosomes na ihang i-detect. I think this is a cell na parang padulong ng mitosis. I think na siya sa anaphase. Alright. But anyway, so mga specs, those are now the chromosomes nag-state sa centromere pattern. Again, highly selective for what disease? Crest syndrome. Ako, press the buzzer. Okay. Alright, so that's for your IIF. Again, the most widely used na test, your FANA, fluorescent anti-nuclear antibody test. Okay, your FANA testing. Alright, now aside from FANA, napalay summary of anti-nuclear antibodies. So these are the anti-nuclear antibodies and their characteristic ng mga staining, no? And their characteristics. So your anti-dsDNA, again, SLE lang, no? For anti-SM, diagnostic pa rin for SLE. So usually dsDNA and SM antigen or antibody to SM, no? Very, very specific for your SLE. And then for patterns, as you can see, and then the different mga autoantibody. Alright? So, I'm not requiring you to memorize talaga theirs, no? Just familiarize, especially mas important ang mga patterns. Okay? Alright. Ayan. So, yes. Alright. So, that's for the summary of anti-nuclear antibodies. If you want to read more, it's in your Stevens, chapter 15, I think, or 14. Alright. Okay. Now, we go on to the other methods of ANA detection. Because again, your FANA, it's quite technical, no? And it can also be expensive because it uses fluorochromes and fluorescent microscope. So other methods were devised that are much more student-friendly, that are much more convenient, much more cost-effective, alright? And the first one is of course ELISA and CLIA. So ELISA, enzyme-linked immunosorbent assay, and CLIA, chemiluminescent immunoassay. So still the same principle, you're detecting antibodies, so antigens, solid phase, and all that. Okay, so ELISA and CLIA. Alright, another method is what we call your Microsphere multiplex immunoassay, or MIA, missing in action. For Microsphere multiplex immunoassay, we use a microtiter plate that consists of microspheres, polystyrene microspheres. And on the surface of your microspheres are your nuclear antigens or your Hep2 extract na lang. Alright, so there are antigens, nuclear antigens, or an extract from your Hep2 cell in the nucleus, no, that is absorbed on the surface of your microsphere. Okay. Now, the beads that contain specific antigens, they can be differentiated by their unique shade of red. Each of the beads has their own shade of red, created by a specific combination of the infrared and red na mga fluorescent dyes. Okay. And antibodies, again, in your serum, in the patient's serum, will only bind to specific antigens on the beads kung asa yung antigen. Okay? Alright. And of course, there's a washing step that after you wash, so ni-bind na yung antibodies on the surface, no, of your microsphere. You wash, and of course, you add then the phycoerythrin fluorescent labeled na AHG. Okay. And of course, we then the bead suspension is then analyzed for its fluorescence by a flow cytometer that has two lasers. So nasa ka laser, one that identifies each bead, and the another laser that detects the amount of fluorescence that is emitted. Okay, alright. And they are more efficient than ELISAs because they allow testing for multiple antibodies lang. Usually for ELISAs, diba, it's usually for one antibody lang, one type of antibody. For MIA, it detects a lot of antibodies, multiple antibodies, to be performed in a single tube, diba? So it's very cost effective. Okay, so here's an example. This is your microsphere, alright? And this is your antigen, this one, diba? Nuclear antigen. This is the antibody found in your serum, and then of course you then attach the fluorescent label, alright? And then you examine flow cytometer, analyze for fluorescence, you identify the beat, and you also detect the amount of fluorescence emitted. Alright? That's Microsphere multiplex immunoassay or MIA. Alright. And the last okay, your immunofluorescence using Perfidia lucilii. Ayan. So, lumabas sa boards pa rin. Alright. So, it's to detect the immunofluorescence, but this time, ang imong substrate, you use a hemoflagellate. So, you detect antibodies to dsDNA lang talaga. Only to antibodies to dsDNA. And you use a hemoflagellate known as Perfidia lucilii. Because Perfidia lucilii has a, again, di ba, recalling your para, if marabag pa ba, your hemoflagellates, they have a circular organelle called as your kinetoplast. And the kinetoplast is abundant for dsDNA. Alright? And we use that. Okay? We use Perfidia lucilii. Ayan. Now, patient 0 is incubated pa rin with Perfidia lucilii ng mga hemoflagellate. Alright? And mag-bind sila, and then you add, after binding, wash, and then you add your fluorescent labeled na mga antibodies or fluorescent labeled tag. Ayun. Alright. And a positive test, brightly stained kinetoplast. Here's an example. Ayan. This one. Diba? For flagellates, oh my gosh, forgive my drawing. Sorry naman. Ayan. So, usually ito yung front, and then this is the nucleus, and there is a small kinetoplast here. And this kinetoplast is what we look after. Brightly stained dapat siya. Okay? Alright. And lumabas sa boards, yes, ang question kay, what is the substrate used for the detection of dsDNA using IIF? Okay? Or indirect immunofluorescence. Alright? Or immunofluorescence. What is the substrate used to detect dsDNA? Ayan, specific talaga. dsDNA antibodies, to detect dsDNA antibodies using immunofluorescence, and that is your press the buzzer, Perfidia lucilii, a hemoflagellate. Lumabas sa boards, okay? Nako, that's why I included it here. Alright? Perfidia lucilii. Again, positive test, brightly stained kinetoplast. Okay, hemoflagellate. Alright, and the last method for detection of ANA is your OctaLony Test na yan, diba? So even here, we perform OctaLony. I forgot to mention the ganina sa mga patterns. There's one pattern that we need to confirm for specificity. Kung unsa na antibody, autoantibody ang naa. And that pattern is your speckled pattern. For speckled pattern, if there is speckled pattern that is observed in the fluorescence, we then subject the test or the sample to an OctaLony test, alright, to determine the specificity of your antibody found, okay, in the speckled pattern. Okay, now it detects antibody usually for your ENAs, your extractable nuclear antigens, your SM, RNP, etc. Ito na mention. PM1, ay wala pa rin. JO1, okay, alright. Now, again, OctaLony, at the center of the well, there is a solution that contains all of the ENAs, alright? Ayan. And then the controls are placed in the surrounding walls. The controls are antibodies. Example, anti-SM, anti-RNP. Alright. Now, a visible precipitate is formed again between the ENA well and each surrounding well that contains antibodies to any of the ENAs present. And if wala, of course, wala yung precipitate. So, no precipitate, meaning wala siya antibodies found in the serum or in the patient. Alright, so here's an example. So, this is a positive from a speckled pattern. So, at the center again are ENAs, no, in a solution. Contains all the ENAs, extractable nuclear antigens. And as you can see, both A are sa serum ni siya, okay, and B po serum of the patient. So as you can see, here is the anti-SM antibody na control, and this one is anti-RNP antibody. Now, as you can see, the A and here nag-form sila o serological identity. So meaning, ang A, this one here, contains really anti-SM antibody. Alright? So this sample here contains anti-SM antibody. Okay, same man sila ang reaction, serological identity, with the control sa anti-SM antibody. But for here, anti-RNP and another A of your serum, di ba? As you can see, spur, partial identity lang. Because your anti-RNP antibody, your SM pala, your SM antibody, tama. Your ENA, di ba? Your SM antigen, your RNP antigen is always complexed with your SM antigen, di ba? So that's why, ni-spur siya here, it's because dili yun siya totally pure na anti-RNP antibody na, di ba? So it's only anti-SM pa rin, but it doesn't cause it doesn't contain anti-RNP antibody. Kaya ni-spur man siya, meaning ni-react na gyapon ang imuhang antigen here to the anti-SM found here. So nagyapon siya pa-spur, okay? Pero, since if you mo siya combine here, wala man siya anti-RNP, antibody, ang letter A, kanina part. Alright? So therefore, dito siya form of serological identity because they don't have the same antibodies present, di ba? And they don't have the same antigen na i-attach siya. Alright? Okay, so muna siya, this is how it is interpreted. Okay, again, this is from your Stevens na book. Alright? But again, for speckled pattern lang, speckled, you confirm it with your OctaLony. Alright. Okay. Ayan. Now, those are all for antinuclear antibodies. Alright. Okay. But aside from antinuclear antibodies, there are also another group of antibodies that can be found in SLE, and that is your antiphospholipid antibodies. I think you're familiar with this na. Hema na naman. Yes, Hema 2. Okay, hematology. Alright. These are a group of antibodies that, of course, by the name itself, they bind to phospholipids. Alone, to phospholipids alone, or phospholipids complexed with protein. Ayan. They can also be seen in patients of lupus. 60% of patients with lupus. Alright? Antiphospholipid, nasa pangalan na. Alright? Can affect every organ in the body, but they're usually associated with DVT, deep vein thrombosis, or arterial thrombosis. Meaning na yung mga clots sa mga deep veins or sa artery. And especially in pregnancy loss. Usually, I've encountered antiphospholipid antibodies usually for testing for pregnant women because of pregnancy loss, miscarriage. It could be that the body of the woman has antibodies to phospholipids. And diba, phospholipids are one of the basic structures, no, fundamental na mga building blocks sa ating cells, diba? So therefore, if may antibodies ang pregnant woman to phospholipids, so yan i-attack ang cells sa baby. So it can lead to miscarriage. So usually yun, na-encounter na antiphospholipid antibodies, it's for pregnant women. Again, to detect mga current pregnancy loss ba. Alright? Okay. Ayan. And they can be identified by their ability to cause false positive mga results din in mga tests. Especially for non-troponamal test for syphilis and the lupus anticoagulant assay in your hema, and even immunoassays for antibodies to cardiolipid or other phospholipids. Ayan. And the lupus anticoagulant, di ba? In your hema, naka-remember po ba? I think, yeah, this is discussed. Hopefully, alright, okay. These are a type of, lupus anticoagulant is a type of antiphospholipid antibody, and it can cause prolonged PT, and prolonged APTP, alright? And it cannot be corrected using normal plasma, so it means that it's really there, okay? And it can affect your coagulation tests, prolonged PT and APTP, okay, alright, ayan. Okay, alright, so I will not dwell further in the lupus anticoagulant. Yes, I forgot my hema na, but anyway, and so that's the point. Lupus anticoagulant is a type of antiphospholipid antibody. Okay? Alright. Ayan. Now for the next video and up to the rest, we'll now continue with the third type of systemic autoimmune disease, and that is your granulomatosis with polyangiitis until the end. Okay? Alright, so I'll see you on the next video. Okay.